Well, hello, everyone. I would love to take an opportunity to introduce you today to Luke's Legacy Family Research Rounds, which is a monthly opportunity for researchers and families to get together and learn about new research related to child health. Now, this is a monthly opportunity that was created in memory of my son, Luke Martins, who passed away in 2020. He was a young man who very much felt like he deserved a seat at the table, any table he chose. He wanted to be the decider in a lot of these situations, and so in the spirit and in his memory, we come here together to share new research and new information, and also share opportunities for people to have a voice in research as well too, as people with lived experience. And I can't think of a better opportunity than today. This is a really awesome group of people, investigators, co-investigators, junior researchers. We are covering the spread today in terms of representation and collective voices coming together. And so today I'm just going to hand this off to the COVID time capsule research team to do their thing. And I just wanted to say in one last statement as well too, that this will be recorded and added to our YouTube channel. So please feel free to share this information as far as you can, and play a role yourself in a part of the dissemination of a very important research. And off to you, Kinga.
Actually, off to Olaf. Anya, do you want to start screen sharing?
I guess I have to unmute to be heard.
Yeah, and give me a second. I'll share my.
Yeah, take your time. I will start speaking and then you can start sharing our slides. Thank you so much, Frey, for giving us this opportunity here. I'm really excited to be part of this group. And I'm only a small part, and you will see I will only talk to the first two slides and give a little bit of background what we are doing here. I have been at many conferences over this year, and there's still some more to come. And whenever I go someplace, I am asked, how do you do that at CanChild, that you engage so well with families? And then I said, well, we do that for a long time. Peter Rosenbaum founded this center, and that was his idea from the beginning, that parents need to be at the table. And then I shared, and actually now we're doing research also with the kids themselves at the table, and they are participating in our research. And this started during the pandemic. Kinga and I did some research with surveys. So these are questionnaires that are sent around online and asking people how they're doing during the pandemic. And we analyzed that, and that was published, and Kinga wrote a chapter about that. And then we thought, well, we should actually ask the children themselves how they experienced the pandemic and what we can learn from that experience for the future. So how maybe there were opportunities to learn to do something differently, or to or stop doing something that we have been doing before. And the best way to find out is really to ask the children themselves. And I'm really proud to have here 4 parents, 4 kids as collaborators on this project, and then also a variety of researchers here at McMaster, not only from CanChild, but also from other areas that are collaborating with us, from child health, from the Department of Pediatrics, that are all putting in their ideas and contributing to that. So I won't introduce all the people that are on this big list here, and rather show you the pictures that are on the next slide. And we'll hand it over now to the mothers first to explain to us a little bit what motivated you to come together with us, and how far have we come up to now with our research, and how was it for you? And then the boys will also give a bit of their perspective and how they contributed. So thank you, all of you, very much. That's an awesome experience to be part of this research group, and I really look forward to more details as we go on with this research. Thank you. I think Genevieve will start now from the parents' perspectives.
Yes, thank you, Olaf. So I took the Family Engagement and Research course because I was really looking for a way to, as a family partner, to have the opportunity to give my voice in research and what I thought were meaningful priorities. And so I was been involved in the study looking at COVID, and I really was so pleased to be able to give my voice about the family experience because it was such a negative one for us during COVID, and to have the opportunity for my son Callum, who's here, to also have a voice in research is so unique and so awesome to be part of this team. So um, I just have a strong belief in parents partnering and families partnering, youth partnering in studies where they're involved, and so they can have meaningful outcomes. So that's why I've been involved. Thank you.
And I'm Amanda. I'm Zach's mom. I took the family engagement and research course in the fall of 2020. And before that, I really had no idea I could even engage in research. I wanted to be able to contribute to research based on the experience we had, and also because I had an interest as a basic scientist science researcher before I became a stay-at-home parent way back in 2006. I really enjoy being part of this work. This is one of the early projects I got involved with, but my tool, or one of our group tool that came out of the FER course, was a youth engagement research Instagram page, and that came out because we really strongly believe that youth should have a voice, and we wanted to convey to youth all about engagement and research. So when this opportunity came up, I didn't know for sure if we would do it, and Kinga invited me to the first meeting, and then I asked 2 of my children if they would like to be involved, and one of them chose to. And it's really, really a privilege to do research with one of my children. We have some interesting conversations about this and many other research ideas outside of times. I really do feel strongly that you can't learn about the family through one perspective only, and we need multiple perspectives.
Janine, do you want to chime in next? You're muted. You're still muted. Do you want us to come back to you? Okay. How about we'll pass it on to Daniela, and we'll let Janine figure out her audio. Daniela, do you want to go next?
Sure. Hello, everyone. My name is Daniela. This is Vasilia, my son. Yes, I did finish FER course, but before that, I was lucky to get involved with the Efforts project back in 2014. So since then, yeah, I think I was learning we were all learning at the time how to get involved and how to do your part in any project. But then I finished the FER course. I think I was in a first cohort when it started right away, and that gave me some material to and empowered me as a parent to be in this kind of projects. This one, this project is really something that it resonates with me because we did have a hard time during COVID. And of course, I love Kinga and the team. Yeah, and Vasilia too. And I was like, yeah, I want to involve Vasilia, but how? I mean, he's nonverbal. But then, of course, we did find a way. So, well, thank you, Kinga and team, for inviting us and having us with you. I hope Janine resolved her audio.
I have. Thank you very much. I appreciate you giving me that save, Daniela. I'm on my phone and I don't normally take Zoom calls on my phone, and I'm having a hard time actually seeing what I'm doing with my Gen X eyes and my glasses. So here I go. I am also a fellow cohort of the Family Engagement and Research Program. I owe actually a lot to Ray, because I had seen her uh, a few years back advertising about parents partnering in research. And I thought, I do a lot of research on my own. And as parents of children with disabilities, medically complex or not, we spend a lot of time burning the midnight oil researching. And I just happened to come across Ray's post, and the rest is history. I'm really happy to be part of the Family Engagement and Research Program. It really taught me a lot, not only about my son that has a rare genetic disorder, it also taught me a lot about myself, which I'm the carrier of that disorder. It was really important for me to be involved in the COVID in Youth time capsule research study. And this is the first time that I've actually been able to work with my son, Maddox. And I've learned a lot just reading the parents' interviews. We had a key message that both the children's and parents expressed just how important it was for kids to have meaningful relationships and connections with other people. And these connections needed to be consistent and reliable. And since I was a parent going through the pandemic as well, and parenting and homeschooling, it really touched my heart with the honest expression that the parents and their children had, and in terms of being part of the COVID Youth Time Capsule. And I am really happy to be here, and I'm really proud of my team, and I'm really proud of our junior researchers and my son, and I'm really proud and I think very fortunate and blessed to be able to share this work. So thank you.
Well, I'm just going to jump in and say thank you so much to our mother partners for being part of this with us. And I mean, you're such an integral part of the team, and you're really, driving this team and giving it, the direction which it's going. So we are so very fortunate to have you. And Anya, if you can move to the next slide, we are so lucky to have our 4 junior researchers. And I am like beyond touched that they all showed up today to this talk. I'm so happy to see them, and just, yes, I'm really happy that they came to a research talk. But this way I get to like brag a little bit about everything that they did for the study, because really they were part of this team even before, as we were writing the grant and sort of dreaming about, if we get the money, it would be nice to do this. They were part of these conversations, from that point on. And they really provide input into all aspects of the study. They helped us. There's a visual component, which you will see in a minute. They helped us design it and made it a whole lot better. They helped with recruitment. You'll see a recruitment video in a minute. They reviewed some of the data, and right now they're helping us with the knowledge translation, and you'll see an example of that. So I am thrilled to introduce you to Callum and Zach and Vasily and Maddox. And I think maybe we will start out by sharing some examples of their great work. And then this is kind of the unscripted part. We'll give them a minute to share something about the study if they want to. So maybe let's start with an example of a recruitment video that was made by that was made by Callum, and it's on TikTok and YouTube. So we're really happy to that he took the time to do that for us, and I think it's a good way to reach people outside of the traditional research networks. Anya, can you show it? Oh, now your audio is not working.
Okay, let me try to fix it.
Of course, it worked when we did the trial run.
Anya, it may be when you shared screen, you have to check the little box that says share audio. And if you didn't check that box when you shared your screen, we won't hear the audio. So you might want to unshare and reshare and then make sure just you check that box.
Let's try again.
Hi, my name is Callum.
Can you hear it? Yep.
I'm a junior researcher on a study at McMaster University.
We are talking with kids, youth and their parents about their experiences during the COVID pandemic and what they need to support them moving forward. We are looking for kids or youth ages 8 to 21 who have disabilities or extra healthcare needs and their parents. We designed this study so that all kids and youth can participate in a way that works for them.
It's actually fun to do.
Plus both kids and their parents get a gift card as a thank you for their time.
Want to learn more? Email and website are in the comments. Don't forget to share with friends.
Okay, so thank you so much to Callum for doing that, and to Anya for doing all the amazing pop-up thingies. Couldn't have done it without you. And now we'd like to show you Zach's video. So Callum sort of did the recruitment video for the study. Zach's video sort of comes at the end to do some of the knowledge sharing about what we learned.
My name is Zach, and I'm a junior researcher on a study at McMaster University. We have been working with other researchers on a research study to learn about the lives of kids and teenagers with disabilities and their families during the COVID pandemic and after. We helped researchers plan the study so that it would be fun for other kids to do. For example, we helped design the logo and the time capsule worksheet for kids to complete.
Okay, what does everybody think? Aren't they great? We also had a video from Maddox that didn't quite make it into the presentation, but it is on our YouTube and TikTok channel, which we will share in the chat. So please go and check them out. So now for the unscripted part, we thought we'd sort of take a minute and see if any of our junior researchers want to sort of share anything about their experiences with the study. So I think since Callum's video was first, Callum, is there anything that you want to share?
Yes, I would say it's been very fun, and I've really enjoyed being able to be on it and share everything with everybody.
Well, thank you so much. It's
You're
been
welcome.
a pleasure having you. We loved having you.
You're welcome.
And you really helped us out a lot. Let me turn to Zach. Zach, is there anything that you want to say?
Well, I enjoyed my time doing the research study. It was pretty nice that I got to express my opinion on some things that I know about rather than others. What else? To be honest, I don't have that much to speak for, but it was nice doing the study.
Well, I'm really glad you did it, and you definitely helped to make the study better. Let me see. Who else do we have? Vasily. Is there anything that Vasily would like to share?
Yes, I actually asked him, and he wants to thank you being here. And the thing is that he really enjoyed the time. He was always happy when I say, okay, you have a meeting with a team, and he felt like a part of community, which is really nice. And yeah, you accommodate everything for him so that yeah, that would be. I think it's there is one thing that why he actually, when I ask him, is he going to do this, and it is about COVID and stuff. His graduation was in front of the building with 2 teachers and a little poster during the COVID. So, if, we talked about that, and he said if there is a slight chance to change something, how people deal with these kind of situations, if it comes again, I will do it. So there you go.
Well, Vasily, thank you so much for being here. It's been great having you, and I'm so glad that you come out and be part of our meetings with us. And last but not least, let me turn to Maddox. And I see his mom put in the chat, he wants to ask everybody how their Halloween was. My Halloween was great. My kids got like 50 pounds of candy. We trick-or-treated for 3 hours and it was freezing, but we got lots of candy. And I have a secret stash in my desk now, so that I can eat all day. So mine was great. Maddox, do you want to tell us about your Halloween or about the study or anything that you want to talk about?
My brother ate all my old dish.
Oh, that's too bad.
Like every single one.
Do you have other candy left?
Chips, like some.
Is there anything else that you want to share with us?
No.
Okay, it's all good. Well, thank you so much. You made a beautiful video for us, and if it's not on our TikTok account, then we'll put it there. So thanks so much for coming out and being here, Maddox. And if you change your mind, feel free to jump in again later if you want to say anything later on too. All right. Shall we move on then? So I think Daniela was going to give a little bit. We've all introduced ourselves. We've talked about how we work together. I think Daniela was actually going to talk about the details of the study and describe what it looked like and what we did. So take it over, Daniela.
Oh, hello back again. Well, I will tell you a little bit about F-words first. And yeah, I already told you that I am involved very much with that project. But basically, it started in 2011 when Dr. Peter Rosenbaum and Dr. Gorter published a paper titled "The Efforts in Childhood Disability. I Swear This is How We Should Think." Well, this paper is based on, WHO International Classification of Functioning Disability and Health Framework, ICA framework that we call, which describe the various domains of life that influences health. For example, body structure or environment, and personal factors, and the interrelationship between them. So these ideas are translated into efforts for child development, and you can see in pink on this poster, it's fitness, functioning, friends, family, fun, and it was added a future. Whereas much existing research on impact of COVID focus on single domain inquiry, for example, virtual healthcare or something like that, the use of this framework allow us to apply holistic lens to capture the multiple factors affecting children and families' well-being. Of course, you can learn more about F-words on CanChild website, and you can see their app. Next slide. Actually, then you will see it's not the next slide, but you will see what we developed. So based on F-words and ICF framework, we wanted to develop a study that would be actually fun for kids and youth to take a part in, and the study that would be flexible so that any children and youth who want to participate could participate. So together we co-designed a worksheet called the COVID time capsule, which is a form of fillable worksheet that, ask kids to draw or copy or paste images inside to tell us about different things in their lives. Like, you can tell, you can see them overlaying over these boxes. And they can tell us, about their family or friends, or what they do for fun, or what they do about school, what they like to do to move their badness, and what they're looking for the future. In this worksheet also, we had like about me page, and people can, and the children can add some more stuff. But then what we did is we asked kids to complete the time capsule worksheet. We did with pictures and drawings, and you're supposed to see that it was awesome, really. Like just thinking back how those pictures looked like and what they were saying. Yeah, and then we met with them on a Zoom call and talked about their pictures. And then we also met with parents separately to talk with them about their experience. So yeah, I think I can pass by to Anya.
Thank you, Daniela. So now moving on to the, I guess, core of the study and share a little bit about what we've done. So we talked with 18 youth and 14 caregivers because some of the parents or some of the families had a few children with disabilities. So we talked to both siblings in 4 families, and the age range of children was between 8 to 16. And our participants came from 2 Canadian provinces, Ontario and Alberta. And now we're going to share with you some of what children, youth, and parents shared with us in their time capsules and the interviews. And you can see some of the beautiful examples of field COVID time capsule worksheets where children talked about their favorite things and what do they do for fun, or some of the experiences that they had in their disability, on their day-to-day lives, and what do they like to do, to play sports, for example, or video games, and so forth. So the first themes that we found is that COVID complicated and disturbed everyday activities and supports. And both children and parents spoke about missing out on visits and interactions with friends and extended family members, such as grandparents, regular recreation activities, such as sports and traveling. And one of 8-year-old boys, for example, he shares that he missed going on vacation and traveling. And you can see the worksheet where he added, I look forward to going on a trip to a warm beach with big waves. I look forward to summer break, to be outside and with my friends. While school closed, many children lost out on learning, therapies, and supports that they previously received at school. And parents told us that their children were lost, forgotten, or fell through the cracks. And one of the parents, Cora, shared with us, and I will read the quote for you that we present on the slide. He was forgotten for 2 years. All of his therapies ended. There was no education. He could not do online, so there was no education. There was no interaction. There was no respite. There was nothing. It was me and him. Even everybody went back, he had aged out of certain programs. We lost speech altogether. Now we're waitlisted to get school-based language support. Speech was his #1 priority of all his therapies, and we lost all. And during ages of 7, 8, 9, there was no so much that he needed. And that's when we lost everything. It was terrible. He fell through the cracks. And parents also spoke about losing nursing and home care support due to the overall shortage of workers and revolving door of workers. However, we also heard accounts of occasional unexpected silver lining of COVID. And one of them was the possibility to use technology in the new ways for school healthcare appointments, working, socializing, and doing things like shopping. For example, for some children, virtual learning worked really well and much better than in person. And remember, Cora from the previous slide described her son as forgotten, but for her daughter, Michelle, and of course we use not real names when we share the quotes and people's experiences. So for her, virtual learning was actually a blessing because it removed the distractions of in-person learning and allowed her to find her strengths and abilities. And this is what Michelle told us. And again, I will read the quote from the slide. I really found myself, I'd say, through COVID, because it gave me a lot of time to figure myself out and figure my abilities out and figure my interests out. So if COVID didn't happen, I don't know what if would have happened. I really don't know. Because in in-person class, I wasn't the best. And then online class happened, and I really had more time to focus on these things, and it really helped. And we also can see a picture that helps her to motivate and herself and find strength in just day-to-day life and activities. Moving on, we found that parents filled in the gaps, and they really had to cope with all the closures and restrictions the best they could, and made huge sacrifices to fill the gaps and cracks in support. So there were teachers, therapists, nurses, care coordinators, and program planners as needed. COVID was a time when the burden of being in all these roles became particularly visible, but parents told us that they regularly expected to be at all those roles, even during the regular pre-COVID times. Parents gave us lots of examples of going above and beyond typical parenting duties. And here's one example from a mom who had no background in healthcare, but she actually went and got a job at her local children's hospital so she could have an easier access to her daughter's files in order to coordinate her care. And this is an example of a diagram that she made and shared with us, where she outlined all the different sectors and specialties that she has to coordinate and advocate for. And this is what she said about it. I'm going to do what I need to do because my child would be dead. I know 100% she would be dead if I didn't understand the system properly, because we have had so many near misses, and so this is what it took.
So
and I will...
Okay, so families provided us with suggestions on what they need as they move forward after the pandemic, that's just still occurring. These themes we identified cut across different sectors, including healthcare, education, recreation, and so on. First of all, could you go to the next slide, please? First of all, families need flexible programs and solutions. One thing we heard from a lot of parents is that supports in education, healthcare, respite, and funding programs are too rigid. There's based on a one-size-fits-all or a cookie-cutter approach, and each of us with children knows that is children, and others that work with children know that that's not the case. It doesn't really work in the real world. This means that kids and families who don't fit this mold or this standard child end up slipping through the cracks. One story we heard was about a child who needed speech therapy, but the school speech therapist was not allowed to work on language goals, only speech goals. But this child had language goals that needed to be addressed first. So in the end, they didn't get speech therapy at school at all. Parents told us they needed supports that are flexible. What does this look like? It looks like removing artificial barriers and hoops. For example, funding for services often comes with all kinds of strings. I remember one of the interviews and the mom talking about, I'm going a little bit off script here, but talking about having to budget for nurses in the community and at school, and sometimes they were the same nurses, but the money came from two different pots, and she had to take very good close track of it. So community therapists might not be able to work on goals that are deemed to be school goals, and vice versa. Parents gave a lot of examples of recreational programs, even accommodated programs, that didn't work for their kids because their children were deemed too disabled, too high functioning, or they didn't have the right diagnosis. For the parents, being flexible means working with the children on their own terms. One mother described a successful skating program that worked for her son with autism. Kevin wouldn't really do the lesson, but they were great because they would just let him skate around. And so what would happen is he would just skate around, do his whole thing the whole time, and every once in a while he might look and see what some of the other kids are doing and give it a try here and there. Or the instructor might pull him aside every once in a while and say, oh, here, try this. And so it worked very well for him because he won't follow a full lesson, but he will do a little bits and pieces here and there. His progression was nowhere near what it would be for the other kids going through the same amount of lessons, but he learned to skate. And this is a picture of Zach here. What wasn't clear when he spoke is he has what we would consider a dynamic disability, and he sometimes has episodes of paralysis. And what that meant last year is he likes to do gymnastics, and he was in parkour and he wasn't able to do it. So this year, his sport is wheelchair basketball. And whether you're able or disabled, you're allowed to play wheelchair basketball. So this is a sport he can play on the days that he can't move his legs, and it's a sport he can play on the days that he can. So it's a flexible approach for him. And I'll hand it on to, is it Genevieve or Janine that's next? Janine.
We don't hear you. We don't hear you, Janine.
Hang on, maybe I'll see if I can try unmuting her. I don't.
My apologies, everybody.
Oh, there you
I
are.
am really struggling with my vision today. As I mentioned earlier, another key message in both the children's and the parents' interviews was how important it was for kids to have these meaningful connections and relationships with other people, and that they needed to be consistent and reliable. Lots of kids included pictures of friends and other important people in their time capsules, which showed us how important it is to have the right people. School teams at home and home teams, teachers, coaches, therapists, or doctors who just click with the child. Two of the kids talked about looking forward to going to their hospital appointments because they like to see their healthcare providers. Now, I think that's incredible, really. This girl in the study, she included pictures of having her blood taken. But having those long-term meaningful relationships can be difficult when there is such a high turnover of people like respite workers or EAs or even healthcare providers, which in my personal life I've experienced with my son's own team. On the flip side, we also heard stories about professionals who were simply not invested in their work. And you know, to me, as a parent who has gone through that similar experience, it's heartbreaking and frustrating. One of the lessons we took away from this is that the importance of having skilled, trained, and invested individuals also is investing in these professionals. Thank you.
So my turn now. So parents also told us what they really value, although they rarely got, with the kind of care that is coordinated and takes into account the entire picture of the family's life. Parents brought up lots of examples and information that was not relayed between healthcare providers and school staff, and sometimes even between staff at the same school or the same organization. One parent told us a story about sharing with a guidance counselor information about her husband passing away, which she expected would be relayed to her other child's other teachers, but that never happened. Similarly, information about accommodations or therapy needs would get lost in the broken telephone as soon as the therapist switched positions and wouldn't carry over from one school year to another. A few parents from the study gave us examples of coordinated and holistic supports, which was hugely appreciated. Here is one mother, Lily, describing the complex care program at her local hospital. Quote, having one-stop shop for everything, like a broken leg. I have an issue, I have one person I can call. I can text her right now, and she will direct me, and she will advocate for me. But most families don't have that. They go to the ortho or they go to ENT, and they're all separate entities. In my case, it's not a separate entity at all. Yes, I go to ortho, I go to ENT, but if I have an issue with either one of them, I talk to complex care, and then they all sort it out. End of quote. Don't we wish we had that service, that wraparound support? If we could have the next slide, please. So we're just going to conclude our study now. We wanted to open it up to discuss with those of you who are here participating in our discussion tonight, if these ideas resonate with your own experiences, who you think needs to hear this information that we've presented to you tonight, and what is the best way you think to get these messages out there?